Welcome back. I'm so excited to be back. For those of you that don't know, I was on vacation last week, so we went down to Mexico. My 5th time there. Highly recommend it if you haven't been there. It was just a really nice getaway with the family, so excited to be back, but not excited to be back. So definitely enjoyed the sun down there. Hey Lauren, I see you. So thank you guys so much for tuning in. It's a Wednesday night, hump day. I know I love hump day, halfway through the week, so that's always exciting. We have a good lecture lined up for you guys tonight. Tonight, we're going to be continuing our neurovascular series, and we are going to cover seizures. So there's a lot to know about seizures, a lot of different types of seizures, different ways that you treat seizure patients, different precautions and interventions. We're going to cover it all. So we are just going to, there we go. Let's get started here. All right, so again, this is my live study with me. There we go. Okay, so as always, we start with some tips and tricks. So not only for this study session, but also for when you are just studying in general. So you want to keep these in mind. Make sure that you are staying focused, you limit distractions, turn off the TV. You want to turn off your cell phone notifications, even though I'm streaming live on social media. So you get the pass for tonight. But typically, if you are studying, you want to make sure that you turn off your cell phone notifications. Put that phone on silent. Find a quiet place to study, which I know is typically easier said than done, especially if you have small kids. But you want to make sure that you find a time that is convenient for you, where you can really focus and buckle down and find a quiet place to study. And speaking of quiet place, ignore my dogs in the background. They're acting up tonight, so hopefully they behave themselves. But hopefully you guys all know me. You guys all should know me, but I know that every week we have some new faces, so that is really exciting. But for those of you who don't know me, my name is Nurse Kelly Tyrell. I go by Kelly in the real world, but you can call me whatever you want. So I have been a nurse for over a decade now. I've been a nurse for about 12 years, and I became a nurse really because my sister was born with a congenital heart defect, tetralogy of Fallot. So if you missed that lecture, I actually covered that in a previous lecture. So you can find that on my YouTube channel, or you can scroll back on my social medias and look at my past live study with me's, because I actually covered that in one of my lectures in the past. So she was born with tetralogy of Fallot. It is a congenital heart defect, and she needed multiple open heart surgeries, the earliest when she was 3 days old. So I became very familiar with the healthcare system and hospitals at a very early age. So seeing the way the nurses help care for her really inspired me to want to pursue my career in nursing and help other people. So that's really why I became a nurse. I graduated nursing school in 2009 and passed my NCLEX on my first attempt in the minimum amount of questions. We can talk about that later. But I started out in cardiac nursing, then transitioned down to the emergency department, became a certified trauma nurse. And pretty soon after I started in the emergency room, I became a nurse mentor and a preceptor to other new nurses who were just starting out in their career. So found my passion, found my niche. I absolutely love mentoring and teaching. And I have a diverse nursing background. So I went from everywhere from working in the ER to case management to home healthcare as a clinical transitions coordinator to a director of admissions and business development for the largest acute rehab hospital in the whole country. So I did that for a while, again, over my 12 years of nursing. And then a few years ago, I kind of went back to my original passion, which was teaching and mentoring. So I became a nurse educator a couple years ago and have been doing that ever since, helping you guys get through nursing school and also passing your NCLEX. So went back to my original passion, staying true to me. So, all right. So if you guys can do me a favor before we get started, if you guys can just show me some love in the comments. And let me know where you're watching from. I think it's so interesting to find out where my students are all watching me from. And if you're watching this live, go ahead and comment #live. If you're watching the replay, we'll post the replay to this tomorrow. Comment #replay. I'm glad you're the reason. I'm your reason to be a nurse, and you're my nurse even now. Yes, absolutely. That was my sister, by the way. Lauren is my sister, and keep her in your prayers, you guys, because she was actually diagnosed with congestive heart failure. So that is common with patients who have tetralogy of Fallot. When their valve starts failing, they can go into congestive heart failure. So unfortunately, she's having that issue. But I'm going to be there as her personal nurse every step of the way to make sure that I'm advocating for her and she's getting the best care that she can. So keep her in your prayers, you guys, but we're going to get through that. Somebody's watching from Florida. Oh, Florida. I have a love-hate relationship with Florida. I love Florida, but my husband loves it so much that he wants to move there. So I'm just not ready. I'm not ready, y'all. I'm not ready to leave the Northeast and move down to Florida, but maybe one day we'll get down to Florida and we'll pack up and stay. But that day is not today, I can tell you that. All right. So, like I said, we are going to talk about seizures. So with any disorder that you are studying or covering, I kind of like to go in this sequence. So I like to start with the pathophysiology, so that way you really get a good understanding of what is going on in the background with these disorders. So that way you can understand how to help these patients, what medications you can start thinking about that you're going to be giving them, and your different nursing interventions and treatments and things like that. So we're going to start with pathophysiology. All right, so what exactly are seizures? Seizures are a sudden or an acute episode of abnormal, uncontrolled discharge of electrical activity within neuron impulses. So if you remember from my lecture last week, we talked about Guillain-Barré syndrome, and we talked about how you have these axons and these nerve pathways that run from your brain all the way throughout your body, and they connect to different muscles and organs and tissues, and your heart, your autonomic nervous system, things like that. So we have these little neuron impulses that travel through these axons. So what happens with the seizures, there's some kind of sudden interruption in these neuron signals. So there's some kind of breakdown as these neuron impulses are trying to travel through these axons. So when there is that disconnect there, the patient ends up experiencing a seizure. So we have two different types of seizures. We have generalized seizures, and then we have partial seizures. And we're going to go into the specific patient presentations of each of those two types of seizures in just a second here. So why do patients have these seizures? Well, there are a number of causes. So it can be acute in nature, which means that they can have some type of sudden underlying condition that is causing the seizure. So most commonly, you'll see an increased intracranial pressure. So we're having something going on in the brain and it's causing a lot of swelling. And you have a hard skull, obviously, surrounding your brain. So your brain can only expand and swell so much. So once that pressure becomes too great, you have a lot of neurological effects. And one of those being seizures with the increased intracranial pressure. So what can cause that? Well, the most common causes are some kind of blunt force trauma to the brain. Also a stroke, whether that be hemorrhagic or ischemic, or some kind of tumor that is in the brain that is occupying a lot of space in that brain and causing, again, that pressure on the brain. You also have metabolic disorders. The most common metabolic disorder that is going to cause seizures is hypoglycemia, because if you remember from my diabetes lecture, I talked about the role of glucose in the blood, and it is our body's natural fuel. So the insulin carries glucose. There's one of my dogs back there. Oli, are you joining in on the session? So the insulin carries the glucose into our cells and into our brain cells also, and it provides that food, that energy that we need to function. So if a patient is having hypoglycemia or low blood sugar, the brain is not going to respond well to that because you're basically starving those brain cells. So it's going to throw the patient into a seizure. Also, withdrawal from drugs or alcohol. That's a really common that is a really common reason for patients to have seizures. They've become dependent on these chemical substances, and it changes the chemical activity in your brain. So when you're suddenly taking these chemical substances away from patients, then their brain doesn't really know how to respond to that. And a lot of times they respond by having seizures. And seizures can also be chronic in nature. So after you've ruled out all of your acute reasons, you always want to start there. You want to try to rule out any kind of underlying condition, or like I said, if there's any kind of increased intracranial pressure, drug or alcohol withdrawal, things like that. When you rule all of that stuff out, then the patients are likely going to be diagnosed with a chronic seizure disorder known as epilepsy. And epilepsy really is it's just the seizures that happen. There are no underlying factors that are causing the seizures. It's just a disconnect with the neurons in the brain getting to the cells, getting to the tissues and organs and other cells throughout the body. So some patients, there's no reason they're diagnosed with epilepsy. All right, so now let's talk about the specific signs and symptoms. And we're going to go into each different type of seizure because there are many different types of seizures. And you as the nurse, you want to be aware of the different types of seizures. That way you can recognize the type and know how to treat it. Okay, so the first class of seizures is the generalized seizures. And specifically under the generalized seizures is tonic-clonic. So we're going to talk about that one first. So tonic-clonic, that is going to be your most common. That is going to be your most classic. When you see patients in the movies having a seizure, this is what you see. You see tonic-clonic. So it involves full body stiffening or rigidity. So the patient is going to get very tense and very stiff. And that is known as tonic. They're in a tonic state. They're also going to lose consciousness. So when you try to stimulate them by doing a deep sternal rub, they're not going to respond. They're gonna have complete loss of consciousness. Also, they're going to have these rhythmic jerking motions of the extremities, and that's where the term clonic comes from. So clonic means that rhythmic jerking motion, and then tonic means that full muscle rigidity. So again, these are your classic seizures that they're the most common type of seizures that you're going to see. The next type of general seizures is known as tonic seizures. So just like we talked about tonic-clonic, it's going to be similar to the tonic-clonic, but you're going to take out that clonic aspect. So that means that these patients are going to experience that full body stiffening or rigidity, and they're also going to have the loss of consciousness aspect to it, but they're not going to have those jerky movements that we just talked about, known as clonic. The next type is clonic. So opposite to the tonic seizures, so they're going to have the loss of consciousness like they would with the tonic-clonic, but they're just going to have the rhythmic jerking motions of the extremities, that clonic. So they're not going to have that stiffening, so their muscles will typically be very loose and flaccid, but they're gonna have these rhythmic jerking motions of the extremities. The next type of generalized seizure is going to be an absent seizure. So with these types of seizures, the patients are going to experience that loss of consciousness. So again, you're not going to be able to arouse them with any kind of stimuli. They're going to look like they're staring off into space, almost like they're daydreaming. But when somebody is daydreaming, you can snap your fingers, or you can give them a little push on their shoulder, and they'll respond to you. But with absent seizures, they're not going to respond when you try to get their attention. And you're not going to see any change in muscle activity or tone. So these patients can be sitting in a chair and they're not going to fall out of a chair, and sometimes they can even be standing, leaning on a counter or something, but they're not going to fall over. You're not going to have any change in that muscle activity or tone. It's more the blank stare, the loss of consciousness, and you're not going to be able to break them out of that daydream-like state. The next type of seizure, hey Sean, I see you. The next type of seizure, generalized seizure, is myoclonic seizures. So with these myoclonic seizures, they're going to mimic the tonic-clonic seizures, but there are two differences. So the rigidity and the jerking movements will be localized to one muscle or a cluster of muscles. So that is the first difference. So you're not going to see that whole body shaking and muscle tightening like we talked about in tonic-clonic. It's going to be localized. It's going to be localized to just one area of the body. So that could be just one arm, it could be one leg, it could be just the head or the neck. It's going to be localized just to one area of the body. The second thing that's going to make myoclonic seizures different is that the patient is not going to experience a loss of consciousness. So they're going to be awake and they're going to be aware of what's going on, but they're going to have that one muscle group that's going to be seizing. But the patient is going to be awake. Unlike with the tonic-clonic, the patient's going to lose consciousness. The next type of generalized seizure is an atonic seizure. So with this type of seizure, the patient is going to become very flaccid and they're going to lose their muscle tone. So they're just going to be very limp and flaccid. And typically they're not going to have a loss of consciousness with this type of seizure. So their muscles are going to give out. They're going to be very limp and flaccid, but they're going to be aware and they're going to be able to speak to you. They're not going to typically lose consciousness with this type of seizure. And these seizures are also called drop attacks or drop seizures because it's exactly what I said. If a patient is standing and they lose all their muscle tone, what's going to happen? They're going to fall over. They're just going to suddenly drop to the floor. So these patients are at an extremely high risk of developing some kind of trauma from a fall. So they are going to be at a very high risk for falls if they are experiencing these type of drop attack seizures. All right, so now let's move on to the partial seizures. So we just talked about generalized seizures. Now let's move on to these partial seizures. So you have two different types of partial seizures. The first type is called simple partial. These are also known as focal seizures, and they typically begin with some type of aura. So what is an aura? An aura basically is, the patient describes it as like a feeling that they're going to have a seizure. It's kind of hard to describe, but the patient knows, like they just have this feeling, this sensation that they are about to have a seizure. And with these simple partial seizures, they're going to have an unusual unilateral sensation. They're typically going to describe this as like a tingling feeling. So unilateral means on one side. So it's only going to be on one side of their body. They're going to experience this tingling feeling. A lot of patients also complain of smelling some type of foul odor. So they'll have these sensory changes also with these simple partial seizures. They'll also complain of visual changes. So they may see flashing lights that aren't really there. They may have distorted vision. So they may look at an object and it may look like wavy or like they're looking underwater. So they're going to have these other sensory disturbances as well with these simple partial seizures. And guys, I will get to your question. I will get to your questions at the end. I'm just kind of trying to moderate the comments. Can it be in both legs? So I think you're talking about the simple partial. So for the simple partial, it's not typically in both legs because that would be bilateral sensation. So it's typically unilateral, which means that it happens on one side of the body. And it's like that because of the way the nerve pathways run and where these specific seizures are happening and they're located, it's going to affect one side of the body. Similar to a stroke, but not really a stroke. A stroke has a whole other different pathophysiology about it. And I do have a YouTube video on stroke. So But the unilateral, the pathway where these seizures occur, it causes sensations on one side of the body. So it wouldn't be both legs. It would just be on one side of the body. All right. Oh, the myoclonic seizures. Yes, the myoclonic, it can be in both legs. It's going to be a group of muscles. So it can definitely be in both legs. Typically, though, I will say that you're going to see it located specifically to one extremity, but it can absolutely be in both legs. But you won't see it in like both legs and both arms. That would be your tonic-clonic if you have it in all the extremities. But you can see it in just two legs, but it won't. If it's in both the legs, then it won't involve the arms as well. Okay. Next type of seizure, so your next type of partial seizure is going to be your complex partial seizures. So with these types of seizures, these patients are going to lose consciousness and they're going to experience something called autospasms, which means that they're going to have some kind of repetitive motion of some kind. So the most common type of autospasms that you're going to see with these type of seizures is they might smack their lips together back and forth. And again, these patients are going to have a loss of consciousness. So you're not really going to be able to stimulate them or break them out of the seizure, but they're going to be repetitively smacking their lips, or they might be picking at the air, at things that aren't there, but they're not typically talking. They're just kind of grasping at the air, or repetitive screaming, laughing, crying, or saying the same words repeatedly. So they could be repeating the same word, but they're not going to be able to talk and have like a fluid conversation with you, but they may be repeating the same words or inappropriate screaming, laughing, or crying. So that is the presentation for the complex partial seizures. All right, so now that we understand the patient presentation of these seizures, let's talk about some diagnostic tests that you can anticipate the doctor ordering when patients are experiencing these types of seizures. So the first test is an EEG, electroencephalography. I had to say that kind of slow. That is a mouthful. But basically what an EEG is, it's a very painless test, and you're placing little metal electrodes all over the patient's scalp. And what you're doing is you're measuring normal brain activity. So if the patient is having some kind of absent seizure, something that's not as obvious as like a tonic-clonic seizure, they're having maybe like an absent seizure or a focal seizure, something like that. What's going to happen during an EEG is you're going to see these spikes in brain waves because the neurons are getting interrupted. So you're going to see these spikes in brain waves, kind of like these sparks, I think of them almost. So that's what they're looking for with the EEG. Next, you can anticipate that the doctor's going to order a CAT scan and an MRI because, again, like I said, we want to rule out any kind of acute underlying cause before we diagnose the patient with a chronic seizure disorder or epilepsy. So we want to rule out any kind of acute cause to the seizure. So they are likely going to order a CAT scan and an MRI. Again, we're going to rule out tumors or bleeds or any kind of increased intracranial pressure, any reason for any kind of increased intracranial pressure. The next two tests are a PET scan or a SPECT test, and what these tests do is they assess how well the blood is moving to and from the brain. So they're going to assess the blood perfusion in the brain. Because if the blood is not getting to the brain appropriately or not perfusing to certain areas, then those nerve impulses are going to have trouble. They're going to have a lot of trouble getting from the brain to the rest of the body because they need that blood and they need that glucose. They need those nutrients to travel freely back and forth throughout the body. Okay, so now let's talk about some treatments. So what are we going to do for these patients? Well, pharmacology is going to be really important with these patients, especially preventing seizures from occurring. And also, when the patient is actively having a seizure, pharmacology is going to play a really important role. So you want to make sure that you are familiar with the most common types of anti-epileptic medications. So these are I just picked the top 5 most common types that you will typically see. And again, these medications are not typically given emergently when the patient is actively seizing. We're going to go over that on the next slide. These medications are typically given as a maintenance or a preventative measure to prevent future seizures. So you have carbamazepine, phenytoin, phenobarbital, clonazepam, and valproic acid. These are going to be your most common types of medications for prevention. Now, when a patient is actively seizing, the most common class of medication they're actually going to give is benzodiazepines. And benzodiazepines are typically treated, or they're given to patients to help treat anxiety disorders, but they are really, really effective for treating seizures, because what we want to do is we want to calm the body. We want to make all of those neurons, we want to put all of those neurons to rest in the body. So a benzodiazepine does exactly that. It's an anti-anxiety medication. So it calms the body. It will in turn naturally calm down those neurons. So the 3 most common medications that you're going to give, and you're going to give these typically IV, and we're going to talk about some nursing interventions and ensuring that you have an established IV on these patients, because the fastest route to get these medications to these patients that are actively seizing is going to be through the IV. So diazepam or Valium, lorazepam or Ativan, and midazolam or Versed. These scientific names, you guys. Why can't we just use the generic names? Oh gosh, these scientific names, they get me. Some of these, they're like 15 characters long. They're so long and so hard to remember. But the NCLEX likes to use the scientific name, not the generic name, unfortunately. So we have to know. We have to know them. We have to be able to recognize them and associate them with the generic name. All right, so some other treatments. We want to make sure that we are placing the patient on seizure precautions. Now, I will say that seizure precautions are going to change slightly depending on what organization that you're working for, but these are pretty standard and pretty basic seizure precautions that you are going to want to be familiar with. So you want to place pads on the patient's side rails, because if they're actively seizing in bed, you don't want them to like whack their head on a hard plastic side rail. You also want to make sure that you have functioning suction equipment at the bedside at all times, because when patients are seizing, a lot of times they're going to lose consciousness and they're not going to be able to handle their secretions, their saliva. So they are at a high risk of choking and aspirating on their own secretions. So you want to make sure that you have suction equipment available so you can assist them and get out those secretions so they don't choke on them. Also, having in-wall oxygen available at the patient's bedside. It's ideal to have in-wall oxygen because these patients are going to be at a high risk for falls. So you want to make sure that you have as limited things on the floor as possible to avoid them falling into them or hurting themselves. So having in-wall oxygen versus having a big oxygen tank is going to be the preferred method of oxygen. But when these patients are seizing, especially for the tonic-clonic seizures, they're not going to be moving air effectively because all of their muscles are going to be tense, they're going to be tight, they're going to be unconscious, so their autonomic nervous system is not going to be able to tell them to breathe in and out. So you want to make sure that you have the oxygen available to supplement, so that way during the seizure they're getting some kind of oxygen to keep perfusing that blood throughout the body. Also, you want to make sure that you have an oral airway kit available at the bedside. So these oral airway kits are really helpful. Again, like I said, patients, a lot of times, if they are unconscious, their tongue is going to get in the way. It can actually fold back and it can block their airway. So placing an oral airway is going to make sure that you keep that tongue down and keep that airway open. So again, you always want to be thinking about your ABCs, your airway, breathing, and circulation. So that's going to be your number one priority when you're dealing with an actively seizing patient, is making sure that they have an airway intact and in place. And I touched on this a little bit earlier, so maintaining that IV access with the saline lock, again, because this is going to be the fastest delivery method of medication during a seizure. You can give Ativan as a suppository. So, but that is, that's not ideal. You'd have to strip down the patient and then give the suppository Ativan. So that's not ideal. In children, it works very well. It's very, easy to do that in children. But if we can, we want to make sure that these patients have an established IV, even if they're not getting any IV fluids or they're not getting any other IV medications. If they're on seizure precautions, you want to always try to make sure that you keep that IV access in case they would start seizing, and you would have to give them some kind of benzodiazepine through the IV. And then there's two different surgical options. Again, you as the nurse are obviously not going to be performing these surgeries, but there's two different surgical options that you want to be familiar with. The first is a corpus callosotomy procedure. So what are they doing there? They're actually removing a small piece of the brain if they can pinpoint where these seizures are happening. So again, the EEG is going to help identify that. So if they can pinpoint where exactly the location of the seizure is in the brain, they can actually remove a small area of the brain. The next procedure is a vagal nerve stimulator. So we have a very large nerve throughout our body called the vagus nerve. And the vagus nerve basically is like our super highway for electrical signals that are responsible for rest and relaxation. So I said that's why these benzodiazepines work really well, because they're going to cause the whole body to just relax. But the vagus nerve is actually our body's natural way to help us get into a relaxed state. So the idea with this vagal nerve stimulator is that you implant a small device into the chest under the skin, and you're going to stimulate the left side of that vagus nerve, not the right side. You're going to stimulate that left side of the vagus nerve. And by stimulating that nerve, it's going to cause this total body relaxation, because that's what the vagus nerve naturally does. So if you stimulate it intermittently, the idea is that it will cause this natural relaxation in the body, which will allow those nerve impulses to travel freely back and forth. All right, so nursing interventions. Let's talk about some nursing interventions. You want to make sure that the patient is in a low bed. So sometimes these hospitals call them high-low beds, where they can sit like really low, like almost to the floor low. Because again, they're going to be at a really high risk for falls. And again, you want to make sure that you keep that room free of clutter and sharp objects. So anything that they could potentially fall into, like corners, if you have like side tables that have really sharp corners, you want to get it out of the room. Anything that they could potentially fall into and impale themselves or hurt themselves, you want to make sure that you get those things out of the room. Also, we talked about having diminished oxygen during a seizure. So again, you as the nurse, you want to make sure that you have that in-wall oxygen. You want to make sure that those oral airway kits are available and at the bedside. And when the patient is having a seizure, you want to try to lower the patient to the floor if it's safe to do so, to get them lower to the floor. That way you limit the chance that they're going to hurt themselves. And you also want to turn the patient on their left side. That is going to increase the perfusion in the heart by placing them on their left side. And we do that to maternity patients as well. We always tell them to lay it on their left side, because it's going to increase that blood flow throughout the body. So that's really important to remember too. You want to make sure that you try to get that patient on their left side to increase some of that oxygen. And we already talked about the specific seizure precautions in detail just a couple minutes ago, so I won't go over that again. And aspiration and choking risks, I touched on this a little bit earlier, but again, making sure that the suction equipment is available. And this is really important, you guys. This is really, really important. Never, never, ever, ever stick your fingers or hand in the mouth of a seizing patient. Never do it. Don't ever do it. I'm telling you, these patients will bite your finger right off. They will bite it off. Not intentionally, obviously, they're unconscious, but don't ever do it. Even if your patient has bit their tongue and they're bleeding and you see their tongue like hanging out of their mouth and you just want to pry their jaw open and get the tongue back in their mouth, or you're trying to place an oral airway and it would just be easier if you just take your hands and open their mouth to get that oral airway in. Don't do it. If you can't get that airway in without using your fingers to go into the patient's mouth, don't put an airway in. Just supplement them with oxygen and give them medications to help stop the seizure, but never, ever, ever put your hands inside of a seizing patient's mouth. All right, very good. Pop quiz time. Who is ready for the pop quiz? Hopefully you guys are paying attention. I didn't tell you guys to take notes. I usually do, but if you've joined me on a live before, then you know we always have a pop quiz. So hopefully you guys are paying attention. And you can just throw your answers in the comments. Just put your answers in the comments. Okay, so question number 1. All are potential causes of seizures except, is it increased intracranial pressure, drug or alcohol withdrawal, muscular disorders, or metabolic disorders? Which one is it? All are potential causes of seizures except, is it increased intracranial pressure, drug or alcohol withdrawal, muscular disorders, or metabolic disorders? What do you guys think? What do you guys think? Is it A, B, C, or D? What do you guys think? So we talked about underlying causes of seizures. Okay. C, muscular disorders. So muscular disorders do not cause seizures, even though seizures, the tonic-clonic seizures, involve the muscle groups, the whole body as a muscle, and tonic and clonic seizures as well. But it is not directly caused from any kind of muscular disorder. So that is the right answer. Okay. This is a little case study here. So, your 45-year-old patient is admitted to the progressive care unit for delirium tremens. He has a known history of alcohol abuse. You enter the room, and during your assessment, the patient loses consciousness and has full body stiffening and rigidity. He is most likely experiencing which type of seizure? Is it the myoclonic seizure? Is it tonic? Is it tonic-clonic? Or is it clonic? Which type of seizure do you guys think this patient is most likely experiencing? So we talked about the different types of generalized seizures. That is what these are. These are generalized seizures. So which type of seizure do you think this patient is suffering from? Okay, let's see. You guys right? Tonic. This patient is most likely suffering from tonic seizure because the tonic, remember, is that full body stiffening or rigidity. And then the clonic aspect is the jerky motions. So this case study did not say anything about the patient having jerky motions at the extremities. It just talked about the full body stiffening and the loss of consciousness. So the answer here is tonic. Okay, next question. So you've identified your patient as having a tonic seizure. You've called a rapid response team and the doctor arrives at the bedside. What medication do you anticipate giving to stop the seizure activity? Is it going to be valproic acid PO, clonazepam PO, phenobarbital IV, or lorazepam IV? Which do you guys think it is? So this patient is actively seizing. We've identified, according to the last question, that they are having a tonic seizure. Are we going to give valproic acid, clonazepam, PO, phenobarbital IV, or lorazepam IV? What do you guys think? What do you guys think? Lorazepam IV. So we're not going to want to give PO medications to an actively seizing patient, simply because they're actively seizing. Most of the time they're going to lose consciousness. They're not going to be able to follow commands to swallow a pill. And second of all, having a pill is going to be a longer absorption time. So when patients are actively seizing, we want to get them out of that seizure right away. So IV is going to be the way to go. And lorazepam is an IV benzodiazepam. So lorazepam IV. Okay, last question. I think it's my last one. All are appropriate nursing interventions when implementing seizure precautions, except, is it A, keeping a portable oxygen tank at the bedside, B, placing pads on the patient's side rails, C, having functioning suction equipment available, or D, keeping an oral airway kit at the bedside? Which is it? This is slightly a trick question, but not really a trick question if you were listening to the lecture. So is it keeping a portable oxygen tank at the bedside, placing pads on the patient's side rails, having functioning suction equipment available, or keeping an oral airway kit at the bedside? What do you guys think? What do you guys think? Dun, dun, dun. Let's see who is right. It's A, keeping portable oxygen tank at the bedside. So although we want to make sure that we have oxygen at the bedside, if we're looking at what the most correct answers are, the other ones were more appropriate than this one, because remember I had talked about having in-wall oxygen. In-wall oxygen is going to be more appropriate because you're not going to have that big physical oxygen tank on the floor, which can be a hazard for the patient. If they start seizing, they could fall and whack their head on the metal tank. So keeping in-wall oxygen versus a portable oxygen at the bedside is going to be your safer option. So this is not going to be the correct nursing intervention. All right, guys, so that is it for the lecture part of it. I'm going to have a brief Q&A at the end, but you can check out my other lectures on YouTube. So if you are not already subscribed, make sure you head on over to my YouTube channel. It's just youtube.com/Nurse Kelly Tyrell. I would appreciate it if you would subscribe, click that bell to turn on notifications. And also give my videos a thumbs up if you watch them and they help you. If you learned something that you didn't know before, I would appreciate if you would give them a thumbs up. It really does help out my channel a lot. And these slides are going to be available in my UNursity group only. I will post them tomorrow, so they will get all of the access, the exclusive access to all of the slides from this study with me tonight. And if you're wondering what UNursity is, I'll just briefly go over it. So UNursity is an all-in-one nursing resource hub where you can get coaching, community, and content. You get coaching from me. I'm in that group every single day, answering your questions, talking to you guys back and forth. Also community, I have a diverse nursing community in that group. So we have nursing students who are first-year nursing students all the way up to graduate nurses who are ready to take their NCLEX, or they failed and they've taken their NCLEX before and now they're preparing to take it again. So we have a diverse nursing community. Also content. So you have access to exclusive daily content, also monthly content. And I'll just go over quickly. This is what our daily content schedule typically looks like. So Sundays, you're going to have some Let's Chat posts is what I call them. So basically, we're just going to chat back and forth. I'm going to pose a question, and we're just going to have a conversation. We're just going to chat. We're going to chat. Monday through Friday, we have our practice NCLEX style questions. So these are real life NCLEX style questions with detailed rationales. And I post the different question types that you can expect to find on the NCLEX. So that is Monday through Friday. And then I also have a poll or ask a question just so that way I can get to know you guys a little bit better and you can help me improve on the group. And then Tuesday is my Quick Tip Tuesday. So I post just like little quick tidbits that you'll want in your back pocket once you start your nursing career or as you prepare to take your NCLEX. Wednesday, we do these live study with me's, but the exclusive part of the live study with me is that you get the replay with the lecture slides available. So I only make the slides available in my UNursity group for you to download and use as a reference later. Friday, the educational videos typically go out on YouTube. And then what is exclusive to the group is that I post a post-lecture quiz so you can test your retention and your knowledge of the information. And then Saturday, I post an inspiring quote card. So I'm really big on positive affirmations and just reading things that make you feel good and motivating you. So I like to post those inspiring quote cards on Saturdays. And then there's also monthly digital downloads. So I focus on 2 different topics throughout the month. And then the first of the month, I post the monthly download. So you can expect flashcards, infographics, physical assessments, practice questions, worksheets, skills checklist, procedure assessments is typically what comes in that monthly bundle for the 2 systems that I am focusing on for that month. I also have a really cool ambassador program. If you join, so the more students you refer, the more you earn. So anywhere from 2 students up to 100 students, you can earn anywhere from $20 to $550. So it is a tiered system. And I have more details inside of my UNursity community, but you can either opt to take cash, so $20 up to $550 in cash you can opt to take, or I have a bunch of nursing swag that I put together for you guys that will be really helpful for you as you progress through your nursing career. So you can earn a little bit of extra cash while you're going through nursing school or preparing for your NCLEX if you just refer your nursing friends. And then when you are ready to take your NCLEX, I do have an all-inclusive comprehensive NCLEX review course. So we have a 99.3% success rate, which we are very, very proud of. Our students work really hard. I work really hard to help facilitate them as they study for their NCLEX and make sure that they pass. So this is a really great program. I put a lot of hard work into building and developing this program. And this program is really for everyone. It's for the first-time test takers. It's for repeat test takers, international students, and busy students who need to study when it's convenient for them. So if you need a full content refresh, this is the course for you. And our results are guaranteed. So if you don't pass your NCLEX, then you are going to stay in my program completely for free until you pass. So I offer a 100% pass guarantee, which is really unlike a lot of all of the programs. I don't know any program that offers this type of lifetime access guarantee until you pass. And like I said, it's a very comprehensive review, so it covers all of the major topics that you can expect to find on the NCLEX. And it's all inclusive, so it has all the tools that you will need. It has the content, it has the NCLEX simulated questions, PDFs, and also a known instructor. So you always have me to go to if you have any personal questions, which again, it's not like the other reviews out there. It's typically just a name. You don't have a known instructor that you can go to for help. This program comes with 35 hours of core video content. You can also watch the audio only if you want. So if you are on the go in the car at the gym, you can just listen to the audio if you prefer to do it that way. Also 1,000 NCLEX simulated questions. So that is spread across 20 self-graded assessments, and it really tells you your readiness when you are ready to sit for the NCLEX. So there are 20 different assessments throughout the course that you can take to test yourself to see when you are ready. And these are very detailed questions. They give you detailed rationales to each of the questions, so that way you can get a deeper level of understanding of the content. And there's 12 printable PDFs, and these are really extensive PDFs. Some of these PDFs are 70-something pages. Some of these PDFs are 70-something pages long, so they're really extensive PDFs, but you can download them, you can print them. These will be for you to keep. A lot of students use them to take notes on. And again, this course is self-paced, so you can study when it's convenient for you, which is really nice, and it was really important to me when I was in nursing school. I wanted to be able to study when I had the time to study, or when it was convenient for me, so that way I could really focus and dig in when I was studying. And I'm not going to go over this, but you can see that this is a very content-rich program. So I have a whole introduction section. These are all of the modules, all of the lessons within the program. So you can see I cover everything from management of care, safety, infection control, promotion and maintenance. Every single topic that you can expect to find on the NCLEX, I cover it all in this course. So it is a very robust course. It is very, like I said, content rich, and you are going to have all of the resources, all the tools that you need to pass. And like I said, I'm so confident that you will pass. If you don't, then you are going to stay in my program for free. So what do you have to lose? You don't really have anything to lose. And just for joining me today on this live study with me, I want to give you guys some amazing offers. Just for sticking around and spending a little part of your day with me. So let's start with the UNursity group. So I'm going to give you guys a 50% discount if you join today. So 50% off of the regularly scheduled pricing. So $9.99 a month or $99 a year. And the benefits of doing $99 a year is that you get, the benefit to doing $99 a year is that you get 2 months for free. So you basically pay for 10 months, and then you get the 2 months free. And someone asked if the course was for LVN. Yes, this course is for LVN as well. I have the same pass rate for my PN students that I do for my RN students. I have some really great case studies for PN students who use this course solely, and they have passed. So you can check out those case studies on my YouTube channel, on my social channels. But yes, PNs have a lot of success using this course. So this will be the only course that you will need. And if you are a PN planning to go to RN school, if you purchase this course, I do let you keep the access until you get through RN school and take your RN boards as well. So you'll have it for a long time. But yes, the information, I just tell my PN students, don't focus on the blood and blood product and parenteral therapy section. Because that is going to be for RN. As a PN, you're not really going to need that, but every other section in this program is geared towards RN and PN. So the UNursity community, so I'm going to do this for the first 10 members only. After that, I'm going to increase the price back up to the regular price of $19.99 a month or $199 a year. So after this live, if you guys want to sign up, I will have all of the links in the description, but if you want to sign up for the UNursity community, then that is going to be www.unursity.org. So that is where you will go to sign up for that UNursity community. And then if you are ready to take your NCLEX and you're looking for that all-inclusive, comprehensive, self-paced course, then I'm going to give you guys a 70% discount, so an even bigger discount. So if you join today, then you'll get $350 off. So only $147, you guys. I can't discount it any more than that, just $147. And you get all of that content that I talked about, the 40 video lessons, the 1,000 NCLEX simulated questions, also the 12 PDFs that you can print and download. You get the 100% pass guarantee. So again, you'll maintain access into my program until you pass the NCLEX, and you won't be charged any additional fees or subscriptions, and that is guaranteed. So it's a win-win situation. It's a win-win. All right, you guys. So that is everything that I have for today's lecture. But I will give a couple minutes for a Q&A. So if you guys have any questions, you can feel free to ask me. I was trying to answer some questions. Questions throughout the lecture, but if you guys have any that I missed, feel free to drop them in the chat. Let me see what I got going on here. All right, you guys are quiet tonight. One second, you guys. Okay. All right, well, turn this back on full screen. If there are no questions, then I just want to thank you guys again for tuning in today. I always appreciate hanging out with you. I know it's hard to study. It's hard to study and stay focused, and especially for my repeat test takers, they get really discouraged. But you just got to get back on the horse. You got to do it. You have to commit some time to doing it. So I'm so proud of you guys, and you guys should be proud of yourselves too for tuning in today and participating. Somebody has a question. You can type your question if you have a question before I head off for the night. So go ahead and type your question in there. I'll look out for it. But yeah, so staying motivated is really hard. But I always tell my students that this is just a very brief period in your life. Our life is so long, right? It's so long. But it's so short at the same time. But this is just a very brief period in your life. So you have to make these short-term sacrifices in order to reach your end goal. This is just going to be short-term. You're not going to have to study for the rest of your life. I promise you that. But we have to make these sacrifices in the short term so that way we can achieve our goals in the long term. The review is $147. So that is a 70% off, or $350 off. So it's only $147. And again, that comes with the lifetime access, you guys. So you will have that until you pass your NCLEX. You also get the 40 videos, so there are video content, or you have the option to listen to it as just an audio if you want to just do that. You also get the 1,000 simulated NCLEX questions that are spread across 20 different assessments, and the 12 printable downloadable PDFs. So that is just $147. Do you have a question bank for your students to help with critical thinking? Yes. So thank you so much. That's a good idea. Awesome. So glad you find it helpful. Yes, I do have a lot of critical thinking test taking strategies because that is really difficult for a lot of students. A lot of times, like, they know the information, but you have to change your mindset and think critically, and how you are going to apply the facts that you learn in nursing school. How are you going to apply that to real life nursing? How are you actually going to take care of these patients? So a lot of that is built through test taking strategies. So knowing the different types of questions that are asked on the NCLEX and having strategies in place that even if you don't 100% know the answer, if you have these strategies in place, you can make a very educated guess as to what the answer will be. So it'll give you an advantage even if you don't 100% know the answer. So I have my whole introduction section is all on test taking strategies. So I have an advanced test taking strategy lesson that is a little over an hour long, and it talks about the different question types. It gives you, like I said, some detailed strategies on how to answer these specific question types. I also talk about the nursing process. I talk about ABCs, using prioritization and delegation. So all of that is covered. All of that is covered in my introduction sections. And if you want to learn more, if you want to see in detail what the course curriculum includes, then you can go to www.nclexandchill.com/NC. So So that link will also, it should be pinned in the comments, but that is where you will go if you want to learn more about the NCLEX Internal Review. I have a whole course curriculum breakdown on that, but the whole introduction section is geared towards combating test anxiety and also utilizing different test taking strategies to help you answer questions, even if you're not 100% sure on what the answer is. The access for the test taking strategy, so that is within the course. It's going to be under that first section, that introduction section. I think I want to say it's like the 4th module, but it's going to be in that first introduction section. It's titled Advanced Test Taking Strategies. So that is the video that you want to look for. You're very welcome. You're very welcome. All right, you guys. Well, I don't see any other questions coming in, and we've been at it for an hour. This hour goes by fast, you guys. It goes by really fast, but I do look forward to it. So thank you again so much for tuning in, and as always, if you need anything, please feel free to reach out. But I will chat with you soon. Bye, Lifesavers.